morning, and welcome to the Massachusetts Nurse of the Future Nursing Core Competencies webinar. The future is now. We are pleased that such a large number of our colleagues have registered for this exciting presentation today. The webinar was developed by the This webinar was developed and is being presented as a collaborative effort of the Massachusetts Action Coalition Competencies Integration Team and the Department of Higher Education's Nurse of the Future Competency Committee. The webinar is being sponsored by the Mass Hospital Association, who we would like to recognize and thank. My background, I work for the Department of Higher Education as the Director of Healthcare Nursing and serve as the Project Director for the Massachusetts Action Coalition and the APRN grant, which is Academic Progression in Nursing. In my DHE, I also provide staff support to the Nurse of the Future Competency Committee. This was formed about 10 years ago, and I quote, "It was formed to establish a formal coalition to create seamless progression through all levels of nursing that is based on consensus competencies, which include transitioning nurses into their practice setting," end quote. The aim is to create seamless progression through all levels of nursing education and develop consensus of competencies that would serve as a framework for education and practice. This was formally designated as an action coalition by the National Campaign for Action, which is by the Robert Wood Johnson Foundation and AARP in 2011. The goal was to increase the number of nurses with a BSN or higher degrees, increase the diversity in the nursing workforce. We specifically targeted the development of exciting academic pathways and continued promotion and spread of competency usage to all academic and practice settings across the state. Today, of our academic programs, over 75%, nearly half of our healthcare organizations are using these competencies. They have national recognition and are being used in 18 states. It is important to note that the success in any collaboration work is built on a foundation of effective communication. This leads to productive collaboration and the development of a common understanding that propels the work forward. The Mass Action Coalition and the Nurse of the Future Competency Committee, we have found this approach to be a key factor for inclusion and success in our work. I would like to review the agenda for today's meeting. Today, we brought together a team of nursing colleagues and content experts to present the following. We're going to do a review of the updates to the Nurse of the Future Nursing Core Competencies for registered nurses. We will also be providing an overview of the Nurse of the Future Nursing Core Competencies for our licensed practical nurses. We add an education and practice exemplar and review the revised Nurse of the Future Competency Toolkit with opportunity for questions as well. I serve as the moderator for today's webinar with the help of Lorraine Schoen from the Mass Hospital Association, who's provided oversight for this program. I will now introduce the following colleagues who will be presenting this webinar. Mark Zinski, who will be presenting on the Nurse of the Future RN updates, who is President and CEO of Daily Associates. Mary Beth Pippin, who is the Director of Practical Nurse Program at Southeastern Technical Institute, who will be presenting the LPN competencies and best practices. And also, the Associate Dean of Nursing and Associate Professor of Nursing at Regis College will be presenting an education and practice exemplar. Ayo, who is the Dean Professor of the School of Nursing and Health Services at Simmons College, will be presenting the Nurse of the Future Nursing Core Competencies. I would at this point to pass over to Maureen Straczynski, who is certainly well known to most of you, as she served on the original Nurse of the Future Competency Committee and is active on that committee and has made several significant contributions in the recent competency review process.
From the collaborative perspective that Pat just described, over the couple of years, we began to hear from our stakeholders in Massachusetts and other states who are using the Nurse of the Future core nursing competencies. Collaborators indicated that the competencies might not be as future-oriented as needed, given the 6 years that have passed since our original publication. With the information, we once again turn to the guide for our first work, Florence Nightingale, to assist us in envisioning the future. To envision the future, Florence says that we need to look to the past, validate the present, and envision the future. And this is how we began our journey to update 2010 publication. Our 2010 publication that has become our view to the past, a foundation for the future. So we began listening to our collaborators and reviewing the input from our partners and stakeholders to validate the present. In the process, we identified a number of drivers for the changes we needed to make. These drivers encompass the many changes in the healthcare environment, include focus on the continuum of care and care transitions, the knowledge of the impact of reimbursement changes, integration of population health, and a culture of health. Also included in these drivers were the increasing need to promote diversity across the healthcare spectrum and embrace informatics and technology among all healthcare professionals and organizations. We are also very cognizant of the ongoing collaboration between nursing education, practice, and other key stakeholders with the Mass Action Coalition and other organizations. Each work to ensure a more highly educated and competent nursing workforce for the future. Foundation, we began a rigorous process of updating and revising our 2010 publication. This began with an expansion of the Nurse of the Future Competency Committee to encompass more diversity and new members from both education and practice across all sectors of healthcare and nursing education. We established subgroups or teams who used an evidence-based approach to review 2 or 3 of the competencies and share their work with the full committee for comments and editing. In an open source innovation approach, we also included subject matter experts in the review process. All the competencies were fully reviewed and updated, with informatics competency being fully revised. The outcome of our 2 years of work is our new publication. As you can see, we have not omitted or added any new competencies, but updated the 9 of our original 10 competencies, totally revised the Informatics and Technology competency. In this updating revision process, we focused on promoting diversity throughout the publication. From the perspective that Pat described of having a shared understanding as part of the collaborative process, we define diversity as a conduit for recognizing individuality and differences among the spectrum of race, values, beliefs, choices, and culture, a difference of these from one's own experience. It also includes diversity is an active observation and exploration of the many facets of identity within a safe environment and a set of conscious practices that require consideration of all nursing practice and care to achieve a culture of health and deliver culturally congruent care that is fluid, respectful, and individual. For this definition, we strive to ingrain this concept of diversity throughout the competencies. going to briefly review the key updates across the competencies. You will find more detail within each competency, but this highlights the core concepts that have been added. With our assumptions and included interprofessional collaboration and recognition of the social determinants of health and disease prevention and a culture of health. In patient-focused care, we centered on, again, care transitions, diversity of the human condition, and the impact of social economics, race, spiritual beliefs, gender identification, sexual orientation, lifestyle, and age. For personalism, we included clinical reasoning, goals of health, and self-renewal of the healthcare provider. Leadership, we included the framework from the Institute of Medicine report on the future of nursing, and also described the nurse's role in health policy and the more complex healthcare system. Systems-based practice, we included cost-effective care and a global perspective on health. For the communication competency, added the use of electronic communication and communication across care transitions. The teamwork and collaboration competency with interprofessional education and collaboration competency, and also included self-awareness, diversity, the need to decrease the authority gradient in communication, and strategies to deal with lateral violence. Firstly, we included the 4 elements supporting safety from the Agency for Healthcare Research and Quality, and a description of the nurse's role in high reliability organizations. For improvement, we again focused on population health, variation in measurement, and care of diverse populations. For space practice, once again, we focused on nurses' role in the development of clinical questions, potential research, and the guidelines for women's subject protection. As with earlier, the Informatics and Technology competency has been fully revised to reflect the significant advances in this area over the past 6 years. The guide principle for this total revision was the Institute of Medicine report on the future of nursing, which is on the growing complexity of care, requiring nurses to use advanced technology to both analyze and synthesize information in order to make critical decisions, and also the focus on the need for a more highly educated nursing workforce to meet these demands. In the evidence-based review of this competency, the subgroup worked closely with subject matter experts from both education and practice, whose role focused on informatics and technology. They read the literature and did an environmental scan, as the team believed it was time to move beyond just expert opinion and build higher levels of research evidence. It also focused on the essentials of baccalaureate education and the specific essential for information management and application of patient care technology. They built a crosswalk between the original information and the technology competency and reference materials, mapped items to assemble the new knowledge, attitudes, and skills grid. All of the current references for this competency, as well as for all the competencies, are included within the bibliography for competency within the new publication. This work resulted in a total new definition for the competency, informatics competency, that framed around the 2015 report from the National Academy of Sciences, Engineering, and Medicine, and focused on the need for nurses to use advanced technology to analyze as well as synthesize information and collaborate with other professionals to make critical decisions and optimize patient care. Revisions to this competency were included in the areas of basic communication science, information management, the core components of the electronic health records and its implementation, patient access and rights, information technology research, and emerging areas informatics. All the contributors to this competency and all of the current competency work, past and present, are listed at the end of our current competency document. Many of the individuals on this webinar have been part of the Nurse of the Future work since we began our journey in 2006. With these updates and revisions to the 2010 competency document, we believe that the 2016 Nurse of the Future core nursing competencies now better capture knowledge, attitudes, and skills needed for entry-level professional nurses to practice efficiently, effectively, and safely in the constantly changing care environment. I am now going to the presentation to Maribeth Pepin to share with you the adaptations that have been made to create the Nurse of the Future core nursing competencies for licensed practical nurses.
Today to talk a little bit about the Massachusetts Nursing Core Competencies for Licensed Practical Nurses. As Pat and Maureen mentioned, I had the privilege of participating in the work in 2007 representing LPNs and practical nurse education in Massachusetts. As you see in the slide, we do in this work chose to keep with the competencies similar for the very reason to facilitate seamless articulation from an LPN nurse to a registered nurse, and also to facilitate both education and practice in streamlining the competencies, roles, and expectations appropriate to each level of nurse. Our document looks similar, however, is colored differently and identifies clearly that these are the Massachusetts Nurse of the Future Nursing Core Competencies for licensed practical nurses as opposed to the registered nurses. We differentiate the role and expectation so that it helps classify for both the nursing community and the public what the expectation and responsibilities of each level of nurse is in Massachusetts. We're fortunate to have a group of committed professionals willing to do this work, and our work focused on the following: a commitment to the role of the licensed practical nurse, a strong commitment to try to facilitate academic progression as seamlessly as possible, to focus on a strong collaboration between education and practice, and a commitment to teamwork and collaboration as representative of the nursing community in Massachusetts. That we took to complete this work involved the benefit, quite frankly, of having the Massachusetts Nurse of the Future Nursing Core Competencies for registered nurses already in existence. We then took that document along with the Nurse Practice Act, rules and regulations from the Board of Registration in Nursing, accreditation standards for both the National League for Nursing, outside organizations, as well as the standards and outcomes from the National Federation of Licensed Practical Nurses and National Association of Practical Nurse Educators and Service members. We get input from our practice partners, our advisory board members, current students, as well as members of the community at large, to get as much input and comments as possible before we completed this process. Each nursing school program in the Commonwealth of Massachusetts worked with draft competencies and vetted them through a rigorous process before the final document was accepted and created. If you look at the current slide, you will see the adaptations quite freely we made that identify the differences in role and responsibility between licensed practical nurse and the registered nurse in the Commonwealth of Massachusetts. It was an educating process for members of the committees as well as the community to truly be able to articulate what are the differences in practice. It was important to have practice partners be members in this adaptation and helped clarify many misconceptions that existed both for educators and practice partners. This of variances between the LPN and the RN role commonly focused on the level of scope and responsibility and the participation role that the LPNs have rather than the creation or the development role. You can see that in leadership and delegation, in systems-based practice. We are contributing members as LPNs rather than occupiers of the practice and the process. Team collaboration, safe quality improvement, and evidence-based practice. Again, the language clearly articulates the level of responsibility that's appropriate to the LPN in Massachusetts, and it truly does identify that role as a contributor and a participator rather than the initiator or the developer. We developed the competencies and they were vetted and accepted by key members and stakeholders throughout the Commonwealth. We've then set the stage for our next steps. And as you've heard previously with the revisions to the Massachusetts Nurse of the Future Nursing Core Competencies for registered nurses, our next phase will be to do a gap analysis so that we look at the current curriculum in practical nurse programs to see where may be areas that need strengthening or addition in the curriculum to fully integrate the competencies, as well as into the practice partners orientation as role and responsibility for the LPN. I had mentioned the revisions that were done to Informatics and Technology will be an area that the LPNs will definitely focus on as we make our needed changes to revise those to match the R Competencies 2016 edition. We said earlier that one of our goals was to really talk about best practices in Massachusetts as well as how we helped facilitate seamless articulation and looked at the role of the LPN to the nursing. And this is definitely one of the advantages of having similar core competencies and the same language and setup for the knowledge, attitudes, and skills so that it clearly facilitates those individuals who seek to advance their education and practice and move from the LPN role to the RN role in Massachusetts. Nursing programs in Massachusetts has clearly done exemplary work in this area. It initially started through a grant process where 3 LPN programs worked with 2 university programs in Massachusetts to try to facilitate an accelerated track for education. What the program did was they did a gap analysis at the level to see what the differences truly were in outcomes and in curriculum from the practical nurse programs to the baccalaureate programs and identify areas that were clearly needed to make sure that the transition from LPN to RN focused on those areas that were distinctly different. The advantage this work had was that the terminal program outcomes for the baccalaureate program were the Massachusetts Future Nursing Core Competencies. So it helped facilitate the process of reviewing both curriculum and making sure that there was a fit or clearly identified those areas that needed to be strengthened and focused in the baccalaureate program. Very pleased with the outcomes as students have successfully completed the NCLEX-RN have now entered the nursing workforce in Massachusetts as registered nurses transitioning from the role of LPN to RN, which certainly is back to one of the initial goals that we had when we began this process. What identified were there were some key areas that set forth areas needing additional support, and that the student role and some of the advising issues needed to be earmarked specifically for the LPNs, as that was a different expectation in the practical nurse program than it was in their registered nurse program. In order to streamline the process, what we are now focusing on is trying to identify how we might be able to replicate this great work of creating a seamless LPN BSN model for those individuals seeking to become registered nurses through that process. And one current practical nurse program is implementing a curriculum based on the Massachusetts Nurse of the Future Nursing Core Competencies LPN focus this fall. We are looking to try to standardize across the state the use of the Massachusetts Nurse of the Future Nursing Core Competencies as a framework so that it will facilitate more application of the model's seamless academic progression. We want to sustain the work that we've done and continue to work to link and find a way to bridge and unify the nursing workforce in Massachusetts, clearly utilizing both LPNs and registered nurses appropriately for the level and scope of education for which they have been licensed. It's exciting as we continue on this journey and look forward to being able to offer those individuals modes and modalities to continue through their process. At the same time in the webinar, I would like to transition and turn the webinar over to Diane Welch, who will speak to some of the education and practice exemplars that focus now back on the registered nurse role. So it is a pleasure to turn the webinar over to Diane Welch.
We present two exemplars that focus on academic and practice partnerships. These partnerships led to the development of models of academic progression and transition into practice. The model is academic progression model between Lawrence Memorial and Regis College BS to BS programs. The Regis College and the Leahy Medical Center transition into practice model. The exemplar is a partnership between LMH-RC and the Lawrence Memorial and Regis College AS program and the Regis College BS completion program. The academic progression model is unique because it is between two private schools that can grant the BS degree. Through a curriculum model, students progress seamlessly from one program to the next. The students are duly enrolled in both programs on acceptance to the LMH-RC program. After the first year, the student must commit to continue towards the completion of the BS degree. Admission allows students to take courses at Regis College after that first year in the AS program. Both schools share a course. This course, Concepts in Professional Practice, was jointly by both schools and counts towards the BS degree completion. Students with a previous bachelor's degree in another field can finish the BS degree in as little as 6 months after completing the AS degree with this dual admission process. Students without a previous bachelor's degree can complete the BS degree in as little as 16 months after receiving the AS degree. Programs utilize the Nursing the Future core competencies in their curriculum. Utilize the gap analysis tool that Mary Beth mentioned in her presentation to examine the gaps in the curriculum before developing the model. The model was developed based on the competencies. An example of this was the shared model I mentioned in the previous slide. A gap analysis tool can be found on the DHE website. This tool is used to identify what is being taught in a curriculum compared to what your practice partner and other nursing programs believe should be taught. The second exemplar is a transition into practice model. This model is the result of a Department of Higher Education grant between Regis College and Leahy Hospital and Medical Center. The purpose of this project was to integrate the Nurse of the Future core competencies to the Regis College Senior Practicum and also into the Leahy newly licensed nurse orientation, thus creating a seamless transition into practice model. This vertical model resulted in a strong collaboration between academic and practice partners to strengthen the transition in practice experience for the newly licensed nurse. The transition practice model, now called the TIP model, was developed by Nancy Bittner and Gail Gravlin. As you can see in this model, on the left is the nursing education program utilizes student learning outcomes, the Nurse of the Future core competencies to develop senior practicum experience, and incorporates a student practice experience with an assigned nurse preceptor. Experience in the senior practicum are integral as they transition into their newly licensed nurse orientation. The licensed nurse orientation jointly uses developed learning activities that are mentioned in the model, such as simulation, journaling, reflection, and presentation and group discussion. These activities used in both the senior practicum and the new licensed nurse orientation integrate the core competencies through the KSA knowledge, skills, and attitudes model, utilizing activities such as simulation, reflection, and journaling, as you can see. Both is the competent new nurse who incorporated the competencies into the practice. I now transition this presentation to Judy Beal, who's the co-lead in the Mass Action Coalition Academic Practice Group, and who will talk about the toolkit. I hope you find the toolkit useful as you integrate the Nurse of the Future competencies into your program. I will now pass the program to Dr. Beal.
Thank you, Dr. Welsh. As Dr. Welsh said, we have been working on a toolkit to help academic and practice partners utilize the Nurse of the Future core competencies to their fullest extent. We did this in 2011. The first toolkit was published in 2014, and as you can see, we have revised that just recently in March of this year. Slide, we detail what is actually inside the competency toolkit for you. As I said, since 2011, the Nurse of the Future Core Competencies Joint Working Group have been working to develop this toolkit for academic and practice environments. Specifically, in the toolkit, we have identified current use of the Nurse of the Future Nursing Core Competencies in academic settings and current use of the competencies in practice settings. And the toolkit is a result of our work and hopefully will be helpful to you in integrating these competencies. The purpose of this toolkit is to promote the full integration of the Nurse of the Future Nursing Core Competencies in both academic and practice settings in Massachusetts. We originally started off, it was very interesting, we originally started off as two separate subcommittees, a subcommittee for practice settings and a subcommittee for the academic settings. And we relatively soon realized that if this was truly an academic practice partnership, that we needed to be working together. So pleased to present this on behalf of my colleague, C.C. McVeigh, the Vice President for Nursing at the Bowen VA, and Lorraine Jones, Director at MHA. So in Nurse of the Future Toolkit, the first part of it is the introduction, where it traces the history of the work all the way back since 2008, where we first started working on what these Nurse of the Future competencies were. Competencies and studies for each of the competencies are presented. A gap analysis is presented with exemplars, evaluation, and how you can, as a user of the toolkit, evaluate the toolkit, and evaluation and references for how you can reach us to assist us to continue to revise this document as we really view it as a living, breathing document. The next slide, you can see that in the toolkit, all of the future nursing core competencies are included. On the next slide, we've taken an example of informatics and technology, but this slide portrays exactly what is in each competency. We have, for each competency, the following headings are discussed. So there's a definition of the competency, a statement, section on why is, in this case, informatics and technology, what is it and why is it important? We have questions for reflection in education and practice. We have learning activities in education and learning activities in practice. And as we do this for each of the core competencies. The next slide, using competency of informatics and technology, gives you an example of what an introduction might look like. So, for example, the Nurse of the Future will leverage the capabilities of new technologies to assess and improve patient quality, outcome, and experience through the improved communication and coordination of care, the use of knowledge management, and evidence-based practice tools, and the empowerment of patients. Slide, using again informatics and technology as an example, it highlights some of the reasons why this competency is important. Nurses utilize healthcare information technologies to support their practice and provide superior care to their patients. The goal of nursing informatics is to improve the health of populations, etc. Next slide are examples of questions for reflection in education and practice. Examples of knowledge areas. Computer science, what are hardware and software components required for your EHR system? How is data kept secure, and what is your role in supporting data security? And we give you two other examples around information and application to professional nursing. Next slide, we provide learning activities in education with competency of informatics and technology. Excuse me, a few allergies. For example, we suggest that learn the basics of healthcare information technology by using healthcarait.gov would be a good learning activity for a nursing student. Or develop an activity for beginning nursing students that shows data mining in the EHR. On the next slide, we do something similar, but this time for the practice setting, using again the example of informatics and technology as a core competency. Saying that perhaps a setting could attempt to access their own patient information through the patient portal of their institution, asking, could teach a patient how to access their medical information electronically if they were asked, and then two other examples. We, in the toolkit, provide case studies for the Nurse of the Future core competencies. In the case studies, we provide first an overview, and where we say that the Nurse of the Future will use collaboration between academia and practice partners to promote achievement of the competencies using the framework of the Massachusetts Nurse of the Future competencies for education and practice. In this unit of case studies, we will provide you an opportunity to apply critical thinking to 3 case studies through the lens of each of the 10 core competencies. And questions have been developed to stimulate thought in the real world. Ask, why are case studies so important to the education service partnership? And to the importance of the IOM report and the gap between practice and education, and the importance of using academic practice partners as a lever. we put questions for reflection and learn activities in each of these case studies. And the next slide detail that the toolkit provides an opportunity to apply critical thinking in 3 case studies. 1, infection, 2, fall prevention, and 3, pressure ulcer prevention. Through the lens of each of the 10 core competencies, questions have been developed to stimulate thought in the real-world environment. Each case study includes program outcomes, objectives for the case study, discussion questions for students, discussion question for the practice agency, and a review of all the literature. Slide, for example, information using the core competency of informatics and technology with the case study of infection control and hand washing, we ask the reflection question, does your organization use informatics to track infection control? We suggest they might identify a person in their institution who might be able to help give them an answer. Call them and ask them how they would measure performance. How could individual nurses use information technology to identify a local outbreak in order to enact change, etc.? And we do this same sort of work for fall prevention and pressure ulcers. In the next slide, we some examples of how individuals and leaders in practice and academia might be able to implement the core competencies in their work setting. So first, in education, some examples. The Nursing Future Nursing Core Competencies for Massachusetts could be used as a curriculum framework. So, for example, at Simmons, we use the AACN Essentials of Baccalaureate Education and Master's Education, and we also use CUSIN Quality and Safety Education in Nursing. The Nurse of the Future Core Competencies really combines all of these. There have been critics in AACN in the past who have said, well, why would you ever use this? Why do you need this if you've got the AACN Essentials? This framework that we have developed in Massachusetts really takes all those standards and all those competencies from ACN, NLN, and CUSIN and applies it into one very organized, systematic framework. You can use in education the competencies in course objectives and content during annual formative and summative curriculum review as a clinical evaluation tool to evaluate student competency in senior practicum courses and in faculty orientation. Very interesting that the majority of nursing schools in Massachusetts do implement the Nurse of the Future Nursing Core Competencies in one way, shape, or the other. And then slide, we had how this might be implemented in practice. Early, there was some confusion expressed by practice partners around the word competency, thinking about competencies really being skills rather than what we have identified in the toolkit. But once we've clarified that with our practice partners, it seems that this transition has become much more simplified for them. So in the practice settings, we are suggesting that the competencies could be reviewed in competency programs, performance evaluation, in the work of nursing councils, to organize objectives for workshops, preceptor programs, so in job descriptions, staff orientation, performance evaluations. I know it sounds like a lot in all of these. We are not saying that every practice setting and every academic setting has to do all of these, but just examples of how many of our practice and academic partners are implementing the competencies in their work settings. Going forward, on the slide, we make some suggestions of how individuals who may be wanting to implement the Nurse of the Future Nursing Core Competencies might make next steps. First would be to find out if your organization knows what these are, if they've seen them, and how they are using them. And actually use the toolkit as a guide to implementation, as I said. Don't feel compelled that you have to implement it in every way that we have said, but just as a guide, there are many helpful suggestions in the toolkit. Please watch for a survey that we will be sending out at the beginning of next week. It'll be very, very short, and we are going to be asking how things are using and implementing the competencies. And please contact us for more information or consultation and provide us with documentation and feedback, documentation of how you are using it and feedback of how the toolkit could be improved. The toolkit is posted on the DHE website, and all the committee members' contact information is there. We're viewing this document, this toolkit, as a very helpful tool, and one really is a living, breathing document, so we anticipate many revisions based on your feedback. So I hope that you use it. I hope that you ask us for help if you need help, and I will now turn the presentation back to Pat Crombie, who will wrap it all up. Pat?
Thank you, Dee. First, I'd like to thank the presenters for their time and effort into this presentation. I hope you understand what the amount of great work that's been reflected here, work of many, many teams. And on behalf of the Massachusetts Action Coalition and the Nurse of the Future Competency Committee, we thank you for your participation today. I just want to highlight, as Judy has mentioned, that we will be sending out a survey to you all very soon, and we really do ask for your participation. The results will have the Mass Action Coalition and the Nurse of the Future Competency Committee to identify ongoing priorities related to continuing the spread and implementation of RN and LPN competencies to all academic and practice settings across our state and throughout the nation. Thank you very much for your time and attention. We hope you have a good day. Thank you.